This is Dr. Emmanuel. Today I want us to do a very quick revision on the arterial supply of the spinal cord. So in one of our previous videos, we did a quick revision on the structural anatomy of the spinal cord. And in this video, we will just look at both the arterial supply and the venous drainage, succinct revision. So this image shows us the blood supply to the spinal cord. And we can see that on the anterior view, the blood supply is mainly from the anterior spinal artery, which is this longitudinal artery that runs all through, the midline of the anterior surface of the spinal cord, just in front of the fissure, okay, the anterior spinal fissure. And we can see also that the anterior spinal artery originates from the right and left vertebral arteries, as we can see there. Okay, on the posterior surface, we can see we have two posterior spinal arteries. We've got a right posterior spinal artery, and we've got a left posterior spinal artery. On the anterior side, we have just one spinal artery, which is the anterior spinal artery. Posteriorly, we have the right and the left. So we have three spinal arteries in all. Spinal arteries run from the proximal part of the spinal cord around the level of the foramen magnum, and they run all down to the inferior part of the spinal cord, down to the conus medullaris. Looking at this image looks busy. So obviously the blood supply to the spinal cord is not only by the spinal arteries. We can see other arteries that are coming in, segmental arteries, okay? Segmental arteries from the vertebral artery. We can see segmental arteries from the posterior intercostal artery. We can see segmental arteries from the lumbar arteries, all contributing their own, parts or portion of blood supply to the spinal cord. And just to mention, the vertebral arteries, each vertebral artery is a branch of the first part of the subclavian artery. Remember the code VIT. So VIT, okay? The V is the vertebral artery from the first part of the subclavian artery. Still on this image, we can learn a few things quickly. We can see pia plexus. So the pia mater is that innermost part of the meninges that lies in direct surface, direct contact with the surface of the spinal cord, or if in the proximal situation would be in direct contact with the brain. So we've got the pia plexus. So these blood vessels form a pia plexus, supplying the substance of the spinal cord. Distally, we can see that there's an anastomotic loop. Okay, so this anterior spinal artery, the posterior spinal, the right and left posterior spinal form an anastomotic loop. So they loop from the behind and come anteriorly and anastomose with the distal portion of the anterior spinal artery. So we can see that anastomotic loop there. Still here, I've highlighted this in green. We can see the anterior radicular artery, which is the artery of Adam Quervies. Adam Quervies, or Quervies. I think it sounds German. So it's probably Adam Quervies. It's also called the great radicular artery. Okay, it's from the lumbar artery. Sometimes it could come from the posterior, one of the lower, posterior intercostal arteries. Sometimes it could also arise from the upper lumbar arteries. So let's move to the next slide. On this next slide, we can see a few extracted information I've extracted from the Human Atlas, the Atlas of Human Anatomy by Frank Netters, and some of this other information are extracted from the internet. So the spinal cord receives its arterial supply from the anterior and posterior spinal arteries, which arise from the vertebral arteries, and they are reinforced by branches of the deep cervical, intercostal, and lumbar arteries, as we saw in the previous image. So we saw radicular arteries, segmental medullary arteries, and radicular arteries that support the anterior and posterior spinal arteries. So the largest of the anterior radicular artery is known as the artery of Adam Quervies, or the anterior radicular magna. anterior radicularis magna, okay, which usually arises between L1 and L2, but can arise anywhere from T9 to L5. If we look at this image behind, we can see that it's coming from a posterior intercostal artery, okay, from the lower thoracic, but it can also arise from the upper and if sometimes even the lower, but it's usually around the T12, L1, L2 level, you know, the anterior radicular artery, okay? Intercostal and lumbar radicular arteries arise from the aorta, provide major anastomosis and supply the blood flow and supplement the blood flow to the spinal cord. We've mentioned that. Damage to this artery of Adam-Kerwis may threaten the viability of parts of the spinal cord. So if anything, interrupts blood supply to the spinal cord, for instance, if you've got a tumor, or if you've got ischemic, if you've got a tumor compressing these lumbar arteries, or if you've got maybe during an abdominal or spinal surgery, if one of these major lumbar arteries that supply, collateral blood flow to the spinal artery is occluded or is cut or ligated, then you could have, ischemia of a portion or a segment of the spinal cord, and that could present as paralysis or loss of sensation in the lower limbs. Venous return from the spinal cord drains into a series of longitudinal anastomosing channels, which empty into veins corresponding to the artery. So we'll get to see a slide that shows us what the venous network of the spine looks like. We'll see venous plexuses, both internal and external vertebral plexuses. We'll get to see that shortly. In this image, we can see is a lateral view of the spine of the vertebral column, and we can see that's our spinal cord sitting within the vertebral canal. And in the previous video, we said the vertebral canal is also called the spinal canal, okay, which is different from the central canal, which is that tiny canal within the substance of the spinal cord, okay, that contains CSF. We can see thoracic radicular arteries coming from the posterior intercostals. We can see radicularis magna, the artery of Adam-Kerwis, okay? At this level, it seems to be coming from the T12 L1 level. So it can come from the lower thoracic level, upper lumbar, sometimes from the lower lumbar side, okay? And it's a significant contributor to the blood supply of the spinal cord. This image shows a transverse section or a cross section of the spinal cord and demonstrates how some of these smaller arteries, supply the substance of the spinal cord. Here we can see our thoracic aorta. If these were to be at the L1 level, it would be the abdominal aorta. So we can see our descending thoracic aorta. We can see right there's the posterior intercostal artery, and the posterior intercostal artery divides into, it gives off the dorsal branch. So we've got a dorsal branch, okay? Dorsal means it's going to the back. So you can see it's also going to supply the spinal muscles, the spina erector muscles, and it's going to give the spinal branch. So they have the anterior radicular and the posterior radicular branches. Okay, so radicular means, remember when we looked at the substructure of the spinal cord, we said the spinal nerves emerge from the spinal cord as rootlets, and those rootlets join to form roots, and those roots join to form the rami. So radicular means related to the roots, the spinal nerve roots. That's what the word radicular means, okay? So we've got the anterior radicular artery. If we trace the arrow down there, that's the one here, anterior. And this other one here is the posterior radicular artery. Okay, so they run along the spinal nerve roots. Okay, yeah. They innervate the spinal nerve roots, and they also contribute to the pia plexus. Okay. And we have this branch which actually contributes. So the anterior and posterior radicula do not anastomose with the spinal arteries, just to mention that. But the segmental medullary artery, which is, if you look here, is thicker. The segmental medullary arteries anastomose with the anterior and the posterior spinal arteries. And we have segmental medullary arteries coming from your vertebral artery in the cervical region, and also coming from your thoracic aorta, coming from your lumbar arteries. This image still depicts what we've just mentioned. Okay, we've got the anterior spinal artery, okay, lying just in front, anterior to the anterior spinal fissure. Okay, these are the sulcal or central branches. You've got the sulcal branches or the central branches. We've got the anterior radicular, posterior radicular. Okay, yeah. And this bigger one is a segmental medullary. So we've got the posterior radicular. This is segmental. So segmental medullary, you can see if you trace that, it joins the anterior spinal artery, but the radicular branches supply the roots, nerve roots. They contribute to the pia plexus, but they do not anastomose with the anterior posterior spinal arteries. It's just something to note. So that's a summary of the arterial supply of the spinal cord. The venous drainage of the spinal cord. Important fact to know is that there are venous plexuses. Lots of veins that form a network of veins called a plexus. The plexus that lies within the vertebral canal is the internal vertebral plexus, and it's in the epidural space, okay, which is the space between the periosteum and the dura. All right, the plexus. So we have this internal vertebral plexus. The veins then emerge through the intervertebral foramina. They emerge through the intervertebral foramina, and they form the external vertebral plexus outside the vertebral canal. Okay, we've got that. We've got basivertebral veins. Basivertebral veins drain the substance, the vertebral body. Okay, so you see them draining the vertebral body into the internal vertebral venous plexus. Then the internal vertebral venous plexus drains out, through the intervertebral foramina. Okay, they drain out. They drain into the external vertebral plexus. This cross-section, transverse cross-section, demonstrates that. So we've got the medullary. Medullary means spinal cord. We've got the medullary veins, veins of the spinal cord. We have the anterior and posterior radicular veins. Anterior radicular vein, posterior radicular vein. Okay, they drain into the internal the internal vertebral venous plexus, which is an epidural venous plexus. We also have the basivertebral vein draining the vertebral body into that plexus. And then through the intervertebral foramen or foramina, for plural, you have the intervertebral vein that carries the blood to the external vertebral plexus. And this is the neck, okay, the cervical vertebra. You can see anterior external vertebral venous plexus, and behind you have the posterior external vertebral plexus, okay? And they form the anterior external vertebral plexus. You can see the coalesce, they come together to form the anterior vertebral veins, right and left, that drain into the brachiocephalic vein, okay? The right deep cervical vein drains into the vertebral, they all drain into the brachiocephalic vein, actually. And the right and left brachiocephalic veins form the superior vena cava. So in summary, you just need to know that you have the medullary veins that drain the spinal cord, okay? They drain both into this internal vertebral plexus and through the anterior and posterior radicular veins, via the intervertebral vein to the external plexus. The external plexus or plexi, with anterior and posterior plexi, form the anterior and posterior vertebral veins that eventually drain into your brachiocephalic veins and then, drain to your superior vena cava and then to the heart. So you don't need to know every detail or the name of all the veins. You just need to have an understanding of how the venous pathway or venous flow happens. Okay. So in summary, we have one anterior spinal artery, two posterior spinal arteries, and the three spinal arteries arise from your vertebral arteries, okay, which are branches of the first part of your subclavian arteries, okay. And we also know that we have supporting blood supplies from the thoracic and lumbar arteries. By thoracic, I mean the posterior intercostal arteries, and then we have the lumbar arteries, and we have a major contributor, which is called the anterior radicular artery of Adam Kiewicz, okay, which could arise from the lower thoracic level or the upper lumbar level. And therefore, there are areas of anastomosis where the anterior and posterior spinal arteries communicate. So we've come to the end of this revision. If you think this video has been helpful, if it's helped you to revise what the blood supply and venous drainage of the spinal cord looks like, please like, subscribe, and share with your friends. Thank you very much.